Hi, good afternoon, everybody. Welcome to our eighth work group for the Child Care Licensing Restructuring Project. For those of you that may not know who I am, I'm Chad Allgood. I'm the director for the Division of Early Childhood Care and Development. I just wanted to say thank you all for taking the time to join us today. Those of you that may not have been participating in other meetings, I'll just have a quick rundown of what we're doing today, and then we'll get into the work itself. So a few weeks ago, Department of Human Services and Department of Health, we pulled together the two advisory councils for child care, which includes the Child Care Licensing Advisory Council, which works with the Mississippi State Department of Health, the Child Care Licensing Program, and then the Child Care Payment Program Advisory Council, which works with my division at the Department of Human Services, more specifically the Division of Early Childhood Care and Development. And the purpose of that meeting was to talk about the current licensing program and talk about addressing some of the needs, specifically around the language that's in the regulations, and then how those regulations are enforced. So at that meeting, the two advisory councils voted to move forward with what we are doing now, which is a project to restructure the licensing program. We're going to be doing this in three phases. Phase one, which is the phase that we're in right now, we are focusing on making sure that the new language, which by the way, we are going to be completely rewriting the licensing regulations, not amending the ones that are currently there, but we're creating a new set of regulations. But first thing that we need to do is to make sure that the regulatory language is satisfying all of the federal requirements. And then that's phase one. And as part of that phase, we have broken down the pieces into different work groups. And today, and I'm going to talk about the work groups in a minute, and I'm going to introduce the work group members for what we're going to be addressing today. So phase one focuses on meeting the federal requirements. As we move into phase two, once we complete phase one, we're going to be addressing Mississippi state-specific regulatory language, things that are not necessarily required by the Fed, but that we may need to address that pertain specifically to what is going on here in Mississippi. And then when we get to phase three, we're going to move into the actual implementation of the licensing program, which includes inspections, investigations, compliance with the regulations, penalties, et cetera. We're going to really get into the meat of all that with phase three. So again, today we're focusing on the federal requirements. Today we're going to tackle three. Well, it's actually multiple components. Just because this led to us really being able to. So today we're going to be looking at food allergy and emergency response, pediatric, and then also pediatric first aid and CPR requirements. And again, this is focusing on the federal requirements for those pieces. So before we get started, I do want to just do a quick roll call of our work group members. So just when I call your name, if you'll just come off mute and just say here or present, just so we can just take note of which of our work group members are here. So first up, I have Michelle Rittenhouse.
I'm here.
Hey, Michelle. Thanks for joining us today. Hope Jones.
Here.
Hey, Hope. Thanks for being here. Good to see you. Lori Rollison. We have Lori with us. Nancy Sylvester. We have Miss Nancy with us. Jamila Taylor. Jamila, are you with us? Okay, they may jump on. And then joining us from Department of Health, Tina, if I get your last name wrong, I'm really sorry. You'll have to correct me. I always want to say Thibault, but I think that's wrong.
That's close.
What is?
It's Tebow with the TH.
Okay, Tebow, Tina Tebow, like Tim Tebow, right?
Yeah.
Okay. All right. So, Tina, thanks for joining us. And then we also have Sharitha Bennett from the Department of Health.
Hello.
Hey, Sharitha, thanks for joining us today.
Oh,
Okay, in just a second, I'm going to turn it over to our federal partners, which we are very thankful that our federal TA partners have graciously agreed to join us for these meetings to help us to give us an introduction to what the Child Care Development Fund requirements are, but then also help us make sure as we're moving through the language that we're not taking any missteps and that we are meeting all the requirements. So I'm going to I'm going to introduce Gene in just a moment, but one other thing that I wanted to talk about, just the structure of how today is going to go. So, like I said, we're going to be focusing on food allergy and emergency responses, pediatric first aid, and CPR. We're going to be going through what the current language says, and we're going to be getting suggestions from our work group members on updating the language, making it more clear. The whole goal of this project is to make sure that the regulatory language is easy for everyone, our child care providers, the licensing officials, anyone that is reading the language. There's no guesswork in what the requirements are. So making everything easy to understand, easy to follow. There's no rooms for gotchas. We want this new set of regulations to be a resource for everyone, an information guide on what we can do to make sure that we're keeping our kids healthy and safe in the child care environment. So that's the ultimate goal here. So as we're going through the information, we are going to allow the work group members to give their responses. If you are a member of the public, thank you also so much for being here. We are very grateful that you were taking the time to join us, and your participation is just as important as all the rest of us. But just so that there's no confusion, we do ask that members of the public, we are going to have a public period at the end or once we complete the session with the work group members. And members of the public, you will then be able to give comment on anything that we talked about today. So as we're going through it, make your notes, and please make sure that you're giving us your feedback, because again, all feedback that we're receiving today is very important and very much valued. So I think that pretty much covers it. Just as a reminder, today is about solutions. It's about making positive changes. It's about fixing what needs to be fixed. Everybody that's here is here because we want to, again, make our licensing requirements just overall a better, more positive. Something that our child care providers, licensing officials, anybody, when they look at it, it's a resource and a helpful resource. Okay. So with that said, I'm going to turn it over to Jean Van Orstal, who is our federal TA partner, and she's going to walk through the federal requirements, and then we'll jump into the work itself. Thanks again, Jean, for being here.
Absolutely. So my name is Jean Van Orstel, and I am with this Child Care Quality Business and Support Center. I am a lead technical assistant specialist, and I do the subject matter expert work in health, safety, and well-being. So I enjoy these sessions because they're very much up my alley. I am happy to answer any questions as we go, but let me explain to you a little bit about the overview of the CCDF requirements. So, okay, just checking because I'm trying to make sure I'm on the same slide as you all are. Okay, so if you've attended another advisory group meeting, you will recognize this agenda flow. We will start today with an overview of the CCDF requirements, the topic we are reviewing today. I'll pose some questions for you to consider as we move through the review, and we will wrap up with 2 different discussion opportunities. The first is a rule discussion for the advisory group members, as Chad mentioned, and then the discussion will be opened up for the public comments. If you are not a committee member, again, you may want to take notes and make sure that you have them ready for the public comment portion of the meeting. So when we talk about child care and development fund requirements specific to health and safety, we like to think of them as a three-legged stool. The first leg is the standards or regulations. This leg requires the development of standards based on the health and safety topics, as well as requirements for staff to be trained. The second leg is training. There are two parts to this. The first part references training on the health and safety topics plus child development, and this is called a pre-service or orientation training. The second part of the training includes ongoing training and professional development for staff. The third leg is monitoring. Programs must be monitored to ensure they are implementing the health and safety standards and regulations, as well as completing the training. Today, we're going to focus on the first leg of the stool, the regulations. So today, we're going to focus on topics 4 and 10, highlighted in bold on this slide. There are 11 health and safety topics that CCDF outlines. Of note, for pre-service orientation training, there is a 12th topic, and that's child development. And you can see the topics on your screen. And again, 4 and 10 are the ones that we will be focused on today. So standards for prevention of and response to emergencies due to food and allergic reactions. The Child Care and Development Fund program requires standards to be in place regarding the prevention of and response to emergencies due to food and allergic reactions. Allergic reactions can vary from sneezing or hives to life-threatening anaphylaxis caused by eating, touching, or inhaling an allergen. Allergens are not limited to just food. They can also include insect bites, plants, latex, which is present in some gloves, dust, pollen, and pet dander from dogs or cats. Standards for allergies could include requiring a written health care plan to be developed to contain a care plan, prevention measures, and emergency procedures. Standards that address foods that are choking hazards help reduce medical emergencies due to food. And children 3 years of age or younger are especially vulnerable to choking. So standards for pediatric first aid and pediatric cardiopulmonary resuscitation. Standards must be in place for both pediatric first aid and pediatric cardiopulmonary resuscitation, or CPR. The standards must address both items specifically for the pediatric population. To safeguard the well-being of children in early learning environments, early childhood personnel must be equipped to handle routine injuries as well as critical injuries or emergencies requiring emergency medical services. Pediatric first aid provides direction in those situations and when pediatric CPR may be necessary. Pediatric first aid and CPR should account for the differences between treating infants and older children. The CCDF program serves children from birth to 13 years of age, and the standards must apply to this age group as appropriate to the setting and the age of the children served by the provider per CCDF regulations. For example, if CPR training for infants would not be necessary if the provider serves only school-age children. The Merck Manual on CPR in Infants and Children indicates that pediatric CPR is different for infants and children. Infant guidelines apply to those younger than 1 year of age, whereas child protocols apply to those who are 1 year of age or older, up to the weight of 121 pounds, or until the presence of signs of puberty. Adult resuscitation protocols apply to children past the age of puberty or children weighing more than 121 pounds. Therefore, training in adult CPR may be necessary in addition to pediatric CPR. So what types of indicators do we look for? When we look at prevention and response to emergencies due to food and allergic reactions, we might look at food allergies, care plans, prevention standards, response standards, again, environmental allergies, and thinking about choking. And for pediatric first aid and CPR, basic first aid skills and supplies, age-appropriate CPR training requirements. So today we will work through specific regulations from these rule sections as part of our discussion, noting that there may be additional rules in other sections that are related, but will be addressed during future conversation as part of phase 2. So there are questions we want you to consider as we are going rule by rule today in our discussion. First of all, does a particular rule present a challenge in how it is worded or written? Are there specific rules that you feel are repetitive or could be combined or condensed? If so, can you describe which rules? What changes or improvements would you make? Are there specific rules that you struggle with or find difficult to implement? If so, can you describe which rules? What changes or improvements would you recommend to make them easier to follow? Are there rules that you find are confusing? If so, can you describe why? What changes or improvements would you recommend to make them clearer? Do you have suggestions for rule changes to help ensure high-quality childcare and reduce the burden on current childcare providers?
There's,
For-
okay. Mine was 40. 40? Yeah, ours was 40. Okay.
Or for new or potential childcare providers? Do you have other suggestions or feedback you would like to share regarding the rules? Are there any questions about the CCDF requirements? Okay. Not hearing any. We are going to transition into the rule review discussion, and I'm going to turn it over to Lakeisha. Am I turning it over to you?
Good afternoon, everyone. Can you hear me okay?
Sure can.
Okay. Thank you, everyone, for joining us this evening. As they've stated, today's work group will be looking at prevention and response to emergencies due to food and allergic reactions and pediatric first aid and CPR. All right, so the first item we're going to look at is going to be on a prevention and response to emergencies and is related to subcomponent for prevention and response to emergencies due to food and allergic reactions. We'll look at Rule 1.13.2, feeding infants and children. And it states, a signed written feeding plan for children less than 1 year of age shall be obtained from parents. Instructions from the parents shall be updated 2 times annually or as new foods are added or as other dietary changes are made. The feeding plan shall be posted in the child's assigned room and must include the child's feeding schedule, the amount of formula or breast milk to be given, instructions for the introduction of solid foods, the amount of food to be given, and notation of any types of commercially premixed formula which may not be used in an emergency, because of food allergies. That was a lot of information. First off, I think we're gonna need to bullet that out to make it a little bit easier to read. Any other thoughts on that rule?
I had a thought on where it says posted. I'm not sure that that is the best idea. It should be available, but some centers, for example, ours share that space with a church, and just for privacy reasons, we don't post that so that, other people that use that same room can see all of that. Does that make sense?
Mm-hmm.
Yes, and Michelle, I agree because we keep ours in a binder. We have a separate binder for our meal plans for our infants, and it is kept in there right where our teeth.
So maybe instead of saying posted, have it readily available and where the teachers know where the information is held. Okay. Any other thoughts on that rule? Anything in there is unclear? Okay. We'll move to item number 2, Rule 1.13.27, feeding infants and children. It says food for infants or children less than 1 year of age shall be cut into pieces 1/4 inch or smaller, and foods for toddlers shall be cut into pieces 1/2 inch or smaller to prevent choking. Any thoughts or concerns on that rule?
I think there's some room for confusion there. For example, if we give a toddler, so maybe a 1.5-year-old, a sandwich, for example, do you have to cut that whole sandwich into 1/2 inch pieces? A lot of them would prefer just to be given the sandwich. It depends a lot on the child. So a blanket rule about cutting them, like what everything has to be cut, it's just there's room for confusion there.
So maybe specifying which foods need to be specifically, like examples of what would need to be cut to prevent choking. And I think there may have been some examples at one time in the appendix, the nutrition appendix of foods that pose choking hazards. So maybe we can put some examples of what would need to be cut down into those sizes. Because the main thing is regarding the choking hazards to prevent choking, and biting into a sandwich is a little different than eating some other items. Okay, we can look at that. Any other thoughts? Okay. We'll move on to item number 3, Rule 1.13.28. Center personnel shall ensure that children do not have excessive amounts of food in their mouths while eating and are chewing their food appropriately to prevent instances of choking. Any thoughts on item number 3? Okay, hearing none, we'll move to item number 4. Rule 1.13.29. Children shall always be seated when eating and shall not be allowed to lie down or be put to sleep while food is present in their mouth. Any concerns about item number 4? Okay. Hearing none, we'll move on to item number 5, Rule 1.414CI, parental information. Health and emergency procedures, provisions for emergency medical care, treatment of illnesses and accidents, which include a plan to handle a child in a medical crisis. It says no text changed in new rule, remove text about choking and allergic reactions. And the information they're referring to is in a previous set of rules. It was a little more detailed. It said a plan to handle a child in a medical crisis, including choking and allergic reactions. It said a written action plan prepared by the child's pediatrician to be implemented in the event of an allergic reaction must be kept on file and updated annually. What do you guys think about adding back in a little more specific language regarding emergency allergic reactions? Do you see a problem with that?
Left as it is now without that it's vague, and if it's somewhere else, maybe it doesn't need to be here, but that's pretty vague. Like when I read it, I'm like, okay, what are they talking about specifically? A medical crisis could be, anything.
Right. So you do think adding a little more detail to make it a little clearer would be a good idea?
I
Yes.
do.
Yes, because if we're talking about children who have to have EpiPens because of peanut butter or whatever it may be, that needs to be specific in here because every center needs that information and it needs to be updated as they go to the doctor because sometimes doctors decide to change things. That needs to be updated. So it needs to be clear. There doesn't need to be a gray area.
Okay.
Another thing that goes kind of along with this one, as I've been doing some research on this topic, and this would be something that we would have to look at the state level and introduce to state legislation. But a lot of states now allow for what they consider undesignated EpiPens. And then some of those states allow that schools to have those and even some childcare centers. And that seems to me like something that Mississippi would want to consider, because you never know when a child is going to have their first allergic reaction. So I would love to have like an undesignated EpiPen in case some child randomly has an allergic reaction. They've never had one before. Then you're kind of out of luck until EMS get there, which can take time. And there's not really any harm per se in giving, using an EpiPen, or they even have some options that are not needles now. But that's something that the health department and on the state level, I think we need to look at for Mississippi. Mississippi is one of the few states that does not have provisions for that.
Okay. You can definitely look into that and see what kind of guidance the health department can provide and their thoughts to see about, like you say, because that probably would have to be something that's approved on a state level. So we can definitely get some guidance on that. Any other thoughts or concerns on number 5? Okay, moving on to item number 6. Rule 1.461C, posting of information. The following items shall be posted conspicuously in the child care facility at all times, accessible to employees and parents, menus and food service permits if applicable. Any thoughts or concerns on item number 6?
My thoughts just in general we have our menus posted, but majority of our parents don't even enter the building. And so as we get further along where it says, like, if you do a substitution, it has to be written on the menu, and things like that. I think that in today's day and age, we need to include provisions for technology. Our menus are also in the app. And one time we made a literally as the my child care inspectors were walking in the door, I made a menu substitution change. And as we were, greeting and they were starting to look at my books, I was sending it out in the app. But because I did not get it written on the menu, we got, of course, docked for not writing it on the menu. And, my other option would have been, oh, I'm sorry, let me write this on the menu before I let you in the door because I'm in the process of serving snack. I think we need to um include provisions for technology and how we communicate with parents, because many more parents are going to see that food menu change in an app than they are posted on the wall.
That's a
I
good
think
point.
also, Michelle, I think you raise a good point. I think when we get to the part about menu planning, I think in some instances, I think there's a little bit of micromanagement that goes on with menu planning sometimes. Um, Proteins are proteins. I think like even with when we get more, and this would be in phase two about menu planning, et cetera. I think giving providers more flexibility within what we know to be sound nutritional decisions needs to happen. I think we're policing too much that kind of thing and I think and right now the regulations don't really give flexibility in terms of substitutions, but maybe even look at listing, okay, as long as you're serving proteins of this nature, the following substitutions are allowable at any time. Because things happen, especially now. I mean, food supply, heck, I go to Kroger and what I picked up last week may not be on the shelf this week. So, things happen like this. So I think that we need to give more flexibility and allow providers to have flexibility again with just some general sound nutrition, as long as there's general sound nutrition guidelines that are being followed, not police so much. Okay, is it green beans today or English peas today? Okay, it doesn't matter. They're vegetables. They're both vegetables. I mean, whether it's green beans or carrots. I mean, at least there are efforts made to provide nutritional, food to the children. Just my thought.
Agreed.
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 Any other thoughts on item number 6? Okay. We're moving on to item number 7, Rule 1.11.13.1, Environmental Health. The child care facility shall comply with all regulations promulgated by the Division of Sanitation of the Mississippi Department of Health for food service.
That rule doesn't even state what those are, so it kind of doesn't mean anything. If that is listed somewhere like under sanitation, that might be a better place to list it. It's just confusing here. I assume they mean trash going out, trash being picked up, things like that, but it's very vague as it isn't written now.
Agreed. Any other thoughts?
I feel like that is listed somewhere else in regulations. I'm drawing a blank, but I feel like that is where it talks about taking the garbage out from the building and also from the premises in a timely manner. And I agree that that's confusing there. if we want to leave it there, maybe just say exactly, what
And
that food service rule is.
we could probably pull it up to look at it, but remember, this is just a compilation of the different rules that relate to that overall topic. So it may be some more information in that actual subchapter, but they just
Right.
any rules that related to the allergic reactions and choking. So there may be some context to it if we actually went into the regulations, but if not, we
Yeah, I
definitely need
think,
to add.
Yeah, and
okay.
we've talked about removing areas where it says see this other area, where it's actually spelled out right here where the requirement is versus having to reference another section. It needs to be black and white right here instead of saying see this other section because that's too much flipping and turning. I mean, you need to see the information
Agreed.
with the requirement.
Thanks. Any other thoughts on item number 7? Okay. Item number 8, Rule 1.13.1, meals and snacks. All meals and snacks served to children in a child care center shall comply with the meal patterns for children in child care programs from the United States Department of Agriculture, USDA. The types of food, number, and size of servings shall be appropriate for the ages and developmental levels of the children in care. The meal patterns for children in child care programs are incorporated by reference and offer a minimum standard by which a facility shall follow. A copy of the meal patterns for children in child care programs is available online at Nutrition Standards for CACFP Meals and Snacks, Foods and Nutrition Service. When children bring their own food for meals or snacks to the center, if the food does not meet the nutritional requirements specified above, the center must provide a food substitution necessary to meet the minimum requirements.
I have a huge problem with this one. We are both a part-time and full-time facility, so we cook for full-time children. But a lot of our children bring their own lunches because they're not here for the required number of hours. They're just part-time. Those parents pack the most random things, and they're going to pack what their kids are going to eat. They're not here all day. Um, I have a real problem with sending basically a nasty note home every day with the child. You didn't pack an adequate lunch, and I refuse to do it, to be honest with you. I do inform them and give them the health department requirements for an adequate lunch and make sure they have access to all that information. But for me to have to do food substitutions that I can't afford, they're not paying full-time rates, or for me to question what those parents feel like is appropriate for them to pack for their child's lunch, I just think it's ridiculous.
I think that goes back to what Chad said a while ago about us looking at the requirements that we're putting in place for the menus and what's required. Because again, like he said, we want to make sure that the children are eating a nutritious meal. And like you said, you got to balance that with if the parents are bringing in a lunch, they're bringing in what their child is going to eat. So you can provide guidance and suggestions. And even if you had a few things to supplement it, but the parents are going to bring what their child is going to eat. They're not going to bring in vegetables that they know their child is not going to eat, and they're also going to pack things that's going to be easy to keep up with as well. So all those considerations have to be taken into account when we look at the requirements that we're placing on centers and parents in terms of the nutrition. So as Chad said, as we get into phase 2, we will need to look more closely at what we're requiring for the menus.
Yeah, I think
We're also-
specifically we need to lay out meal patterns that are easy to follow.
Yes.
Easy to understand.
Yes, and we're gonna have to look at the CACFP too with licensure because there are difference in some things you can serve by state health department and what you can serve by CACFP. So we need to try to stick with that too because you've got a lot of centers who depend on that CACFP, but it's hard to meet the standards because there's two different standards there.
Mhm. And that's something else we definitely have heard in the past, and we know we need to look at because, as you stated, a lot of centers do follow the CACFP program. So if those are the requirements that they have to meet in general, then what we're requiring in the regulations should model after that because they are more the experts in that area in terms of nutrition. So making sure that everything lines up will be important.
But we also need to make sure that we're mindful of the support that our Mississippi CACFP office is willing to provide to childcare, because historically it just hasn't been there. So when we're putting things in place that, if we're saying that we're going to follow CACFP guidelines, we have to ask the question, is it fair to hold childcare for, and I know what you're saying, Lakeisha, like we need to make sure that we're not putting anything in place that contradicts
Right.
programs have to follow for CACFP. I get that. But again, even though we don't want to put anything that contradicts CACFP guidelines, we also need to make sure that we're not putting undue burden on providers that are not receiving support from CACFP.
Right.
Again, historically and presently, our CACFP office is just not the most supportive of getting child care providers to support them. Again, that's my thought on that.
Good point. Any other thoughts or concerns on item number 8? Okay. We'll move on to item number 9. Rule 1.13.5 menus. The center shall provide a menu listing all meals and snacks to be served during the current week. Meals and or snack substitutions shall be reported on the posted menus. Menus shall be retained at the center for 6 months. Use the following when planning menus. Offer a variety of nutrient-dense foods. 2, serve meals and snacks that help maintain a healthy weight. 3, serve a variety of vegetables, fruits, and whole grain rich products. 4, avoid foods high in sugar and saturated fat. Limit fried food to 1 time each week. 5, limit high sodium products and the use of added salt. 6, promote and encourage daily physical activity. All right. What are our thoughts on item number 9? Except for what we've already talked about in terms of looking at the menus in general.
Yeah, there's just a lot of subjectivity here. What exactly does nutrient dense mean? When it says limit, what exactly does that mean? What is high sodium? What's the level? I mean, there's a lot in here that a nutritionist might be able to speak to, but if you're not trained in that regard, really understanding, and y'all, I think this, like Sharita Tina, I think y'all would probably agree. Y'all trying to translate this into what you're saying in programs is probably somewhat difficult for you all as well. Again, I think we need to look more at what are some specific guidelines for meal patterns that an everyday person that is not a nutritionist would be able to understand and follow.
Right. And I mean, it says variety of fruits and vegetables. But when you look at our appendix, the way they want this A's and C's and to be served, that's not a variety. When there's other things we know we can get, you can look up and see what has vitamin A in it, vitamin C in it, and it's different than what's in the appendix. But if you're serving it, when licensure comes in, you get questioned. It's not, we need bigger varieties with more stuff.
And again, as Chad said, like I said, we want to look at giving you guys examples of meal patterns that you can follow and not make it so complicated with the A's and C's and all that, because as I just stated, you guys are not nutritionists, so having to keep up with all that is more important that children are getting a balanced meal. So we definitely want to look at making this a simplified version that you guys could follow more readily. without
Well,
having
pre-
abuse.
yeah, preschool age children are notorious. Like they're gonna want. I mean, I think about my nieces and nephew. I mean, they want the same thing for dinner every single night. So they thrive on ritual and they thrive on the familiar. So
Right.
if you're and listen, I'm all about introducing them to new foods and new things, but in my opinion, use learning activities as an opportunity to introduce them to new foods, etc. Mealtime can already be stressful enough. And and if these kids, if you put something in front of them and they have no idea what it is, I mean, I think that using the requirement of variety here can be a little taxing, especially when you're just trying to get kids to eat healthy. Again, if you find, two or three vegetables that all children are willing to eat, stick to those. So they're getting their vegetables, versus trying to get them to eat beets. I'm sorry, you can put a beet in front of me all day long and I'm not going to eat it. Just, again, I think we need to eliminate the subjectivity here. Any opportunity that we can to offer flexibility to allow for our child care folks to provide healthy food, without just making it extra difficult. I think we do agree with that.
Agreed.
And no offense to anybody that likes beets. If you like beets, you can please have at it. But beets aren't for me.
Agreed, Chad. I second that.
But those are a superfood, guys.
I'm not eating beets either, but sometimes we have, because we have to follow these menus and things, we have kids that they don't eat it. So then they're hungry, then they're grumpy, because they're not going to eat what we're serving.
And grumpy kids often lead to behavior issues and not being able to rest properly.
Agreed. I agree with Chad about those intro to new things. Put that in your learning plan for the day. That's a better way to introduce stuff that most of them aren't going to eat.
Just for some of your children, this is going to be the main meals they get is why they're in the center. So we want to make sure that they are getting fed something that they will eat. So yeah. Be good to move down to item number 10. Right. Rule 1.1369, meal service children shall not share food. Any thoughts or comments on that one? Okay. Item number 11, Rule 1.13610, meal service. Each individual child's lunch brought from home shall be clearly labeled with the child's name and date.
Nobody labels it with the date.
Do you guys go back and label it with the date when they don't, or you just make sure it has the child's name on it?
No, they bring lunch boxes and it has their name on it. We don't bother checking for dates. And I mean, it would be kind of silly.
Because they take it home every day.
They take it home every day. We're not checking for dates.
With the child's name. Any other thoughts on item number 11? Well, we're moving on to item number 12, Rule 1.137, restrictions. Food shall be served according to the manufacturer's instructions and recommendations. Foods that are associated with young children's choking incidents, such as but not limited to peanuts, hot dogs, raw carrots, popcorn, fish with bones, cheese cubes, grapes, chunks of peanut butter, and any other food that is of a similar shape and size of the tracheal windpipe shall not be served to children less than 4 years of age. Children older than 4 years of age may be served these foods provided that the food is cut in such a way as to minimize choking. Food shall not be accessible or served to children until it has been chopped, diced, cut, or mashed and is appropriate for each child's age and individual eating, chewing, and swallowing ability.
I say that's the one we could integrate with that rule 1.13.2.
Yes. I agree, Tina, because that other one was talking about infants, but this spells it out a little more when we talked about examples. So we definitely can look at how those can be incorporated. Any other thoughts?
So this is Jean. I know I'm not supposed to, I'm supposed to be quiet, but I have a question. I'm just going to ask the question. If we go back up here where it says to cut the oh, I didn't go back far enough. Where you're cutting the food into smaller pieces,
You need to be better.
you're saying that infants, you're going to cut it one size, toddlers are going to cut it another size, but then down here, you're saying that you don't serve any of those things to children under 4. So you're just going to want to make those aligned correctly.
Good point. I think those are things that are still saying that they're not allowed to be served to children, but other foods that could still pose a choking hazard. But that is a good point, Jean. Thank you for if we incorporate them together to make sure it's clear that these are still not allowed for infants and children under 4. Any other thoughts on item number 12? Okay, we're moving on to item number 13, Rule 1.139, modified diets. When a child requires a modified diet for medical reasons, a written statement from a physician, RDN, or physician assistant shall be on file. When a child requires a modified diet for religious reasons, a written statement to that effect from the child's parents must be on file. All caregiver personnel shall be informed of the diet restrictions for the child, and only food that complies with the prescribed dietary regimen but still meet the food and nutrition requirements shall be served to the child.
I'm sorry, I have a comment here. I have had a licensing official tell me that we had to have a doctor's note for that religious preference. And I didn't go back and reread it at the time, but the licensing officials need to be on the same page with that. As far as I can guess, it's probably illegal to require a doctor's note for a religious preference on food. But they required us to have it.
So I think in this instance, my opinion is instead of licensing, overseeing this, I think we could and just hear me out, and then if what I'm saying makes sense, good. If what I'm saying doesn't make sense, then we can discuss. But instead of licensing officials overseeing this, what if we were to rephrase it where childcare providers, it's their decision whether or not they would make accommodations for modified diets. We do this for, meeting, for serving children who have special needs, et cetera. In some cases, it may be very cost restrictive for a child care provider to be able to provide a modified diet or to make a separate meal for these children. And in some cases, it may not. But I think, what if we were to just empower child care providers to determine whether or not they would allow diet modifications for medical and or religious purposes? And then we could just say, if there are modified diets for medical reasons or religious reasons, the provider may, it's strong, again, recommended that the provider receive that in writing from the physician or the family, specifically what those are. And that's really more about protecting the child care provider. I mean, it's just as much about protecting the child care provider from liability. That's what I think.
I agree with what you're saying. I'm just saying that because we have to have those letters in our binder, and the licensing official will be, oh, like this letter's more than a year old, or, you have to have the medical note for the religious preference, things like that. And it's usually not things that are difficult to accommodate. They bring in their own carton of milk because they can't have regular milk or whatever.
But again, I think that instead of the licensing official having to look at that, we just say it's y'all's decision whether or not you're going to accommodate the meal modifications. Because, I mean, you could say in your handbook, we do not accommodate meal modifications for medical, or we do not, you can say the parents could bring a meal, whatever. I think we should leave that up to the child care providers. That it should be at y'all's discretion whether or not you accommodate this. That's my thought. So a licensing official wouldn't have to ask for letters from a physician or the parent, and they wouldn't have to say, oh, this is a year old. I mean, at the end of the day, this should be y'all's decision whether or not you're going to make these accommodations. Again, provided that you're providing nutritious meals, Does that make sense what I'm saying?
Yes, it does make sense, and I agree with you. But if you leave this rule in the law like it is, that tells the licensing official they need to look for those notes. So it needs to be rewritten.
Yeah, that's what I'm saying. We should do.
And Jean, could you guys get us some examples of how it's written in other states that may give us some suggestions on wording?
I absolutely can. And I have another question about this one, but I'm going to research it before I submit the question.
Okay.
Because I just am not sure if I know the answer.
Okay. Any more comments on item number 13? That concludes the first section on prevention and response to emergencies due to food and allergic reactions. Are you guys good to continue, or you want to take like a 5 or 10-minute break?
I'm good to continue.
Okay. Looks like the consensus is to continue, so we will move on to pediatric first aid. And I'm gonna just say CPR. I'm not gonna even try to pronounce that because I would mess it up. So we're gonna stick with CPR. Item number 14, pediatric first aid and CPR, rule 1.221, adult, child, and infant CPR and first aid certification. On a temporary license, Adult, child, and infant CPR and first aid certification as required for a person or persons who will be present at the facility during all hours of operation. Any thoughts, comments, concerns? I know CPR and first aid is mentioned a couple of times throughout the regs, and this is just under temporary license. It says required for a person or persons who will be present at the facility during all hours of operation. I think we just need to be a little more clear in regards to coming on another section that says how many people have to have it so that the language is consistent throughout. We just may want to look at that and make sure that it says the same thing throughout the regulations.
Is the requirement different for between a temporary license and a full license?
I'm sorry, Chad, what you say?
Is the requirement different for the when a light the for the temporary versus the
I don't think.
No,
No.
no, they're the same. That's kind of confusing where it just says temporary license. And I agree with also we need to say what number of people because clearly one person, when you read it this way, sometimes they'll say, well, we only have one person, but that person can't be there all the time. So I agree with Lakeisha there.
Any other thoughts on item number 14? Move to item number 15. Rule 1.49. I think that's P, emergency preparedness and evacuation planning. Each child care provider shall develop, implement, and maintain a comprehensive written multi-hazard emergency preparedness, response, and recovery plan to ensure the safety and protection of all children in care during emergencies. The plan must address the following components: multi-hazard emergency plan requirements. The plan shall P, first aid and CPR certification during all hours of operation, including arrival and departure. Child care providers shall have at least one staff member present that A, holds a valid infant, child, and adult first aid and CPR certification. B, renewal certifications must be obtained through in-person, hands-on training. Online only courses are not accepted. Thoughts, concerns on item number 15? Is that clear to everybody? So we can, any concerns about that one? All right, we're on to item number 16. Rule 1.582, staff development. Number 2, all child care staff, directors, director designees, and caregivers shall be required to complete 15 contact hours of staff development accrued during the licensure year annually. The National Association for the Education of Young Children in AUIC, a leading organization in child care and early childhood education, recommends annual training based on the needs of the program and the pre-service qualifications of the staff. Training should address the following, and it has a list of topics. And it says the note in the new rule, first aid CPR was removed from the list of topics for annual training. And I think that's because they would this, and we talked about this in the group on child development. It was just trying to do a more generic list of topics that centers can look at, but we're going to look at how this is worded in the regs as well. That was a conversation that we had during a child development work group. But in terms of the requirements for CPR and first aid, because that's going to be dependent on certification that they receive. So it can be counted in somebody's 15 contact hours, but it has to be when it's well up for renewal. In some centers, I know how their people do CPR first aid every year just to stay on top of it. Um, any thoughts on this rule in general? Like I said, we did have some discussion on that one in the child development, and we have talked about some changes we're going to make. But if you guys have any thoughts on that one in general, feel free to share it at this time.
One of my thoughts just in general is it talks about your licensure year, the 15 contacts hours during your licensure year. And you know, one comment I have is that quality training is difficult to come by. The state only offers so much for free, and you can only take the same things, multiple times. Um, but I'll give you an example. So our licensure year actually starts August 1st. And earlier in July, there was a conference that was a great conference that I would have liked to have taken my staff to. But I can't wait until July 11th for all of my staff to get their remaining hours, because what if they end up being sick or something and then can't complete their 15 hours? So all of my staff have had their hours done. And I had asked the health department, what can we make exceptions for a quality training like that conference that is within 30 or 60 days of your licensure year, so that you can take advantage of a really good opportunity um, for quality training. Instead, we didn't attend because I'm not, my staff didn't want to attend if it didn't count, and I can't afford to pay for them to attend if it doesn't count. Um, Yet a conference like that is some of the best training out there. And they typically occur in the summer, like July, and then, at least in this area, usually you have like January and July. So with a licensure year starting August 1st, we're never going to be able to do a July training, unless there's some give in that.
No, we had some discussion about that in the child development, one, Michelle, of looking at, how we may can revamp the training, because I think you or somebody else mentioned something like that in that one, about trainings and not being able to get credit for it. So we would definitely keep that on our radar as we're looking at the contact hour section in the child development section for the regulations. Okay. Item number 17, we're going to skip it, the emergency preparedness and evacuation planning, because we had an in-depth conversation about that evacuation pack when we went over the emergency preparedness section, and we talked about needing to make some changes to that, and we already were going to be looking at verbiage from some other states to see how to simplify that in terms of what would be needed versus recommended for an evacuation pack. So we're going to skip item number 17 altogether. Item number 18, Rule 1.814, Staffing General. During all hours of operation, including the arrival and departure of children, a child care facility employee shall be present who holds a valid adult child, infant CPR, and first aid certification at any location where the children are present. Said certificate shall be issued by an agent recognized by the licensing authority. Any thoughts or concerns on item number 18?
I think you have a cause for concern when you say any agent recognized by the licensing authority, but it doesn't list them. Obviously you don't want Jim Bob teaching your first aid CPR. But as long as it's a reasonable, I can just see, um, them, oh, well, we didn't approve that one, or we don't approve that one, and you getting into issues with that when you had no idea they didn't approve it.
We could look at having a list of the CPR first aid certifications or what the requirements are for the person to be approved so that some more clarity can be put in the regs on that item.
Lakeisha, I have a statement on that. Instead of
Okay.
providing an actual list, because people can hold that qualification and certification to be able to teach and be certified, but not be on the list.
Okay.
So that may cause some confusion as well. So I think just if you put in what those stipulations are for the qualifications that the trainer must have, who's delivering the trainer, I think that will cover that piece.
Okay. That's a good idea because then if you have a question, you can always reach out to the licensing agency to make sure that person would be considered qualified. Okay. Any other thoughts on item number 18? Okay. Gonna move to item number 19, Rule 1.12.2 for child health. A child with a physical injury shall be treated by a staff member with valid first aid certificate issued by an agent recognized by the licensing authority. A child with a serious physical injury shall be treated by a staff member with valid first aid certificate issued by an agent recognized by the licensing authority and transported to a hospital or medical facility as soon as appropriate. We've already discussed we need to take out that issued by an agent recognized by the licensing authority and make that clear. Are there any other thoughts or concerns about item number 19? Okay. Now we're gonna move to item number 20, Rule 1.12.5, first aid supply. A first aid supply shall be kept on site and easily accessible to employees, but not in reach of the children. A first aid supply shall be taken on all field trips and excursions and shall be easily accessible to employees, but not in reach of the children. 3, medicine shall be kept out of the reach of the children. 4, all vehicles used by the facility in transporting children shall be equipped with a first aid kit. 5, it is recommended that first aid kits contain at a minimum the following items: scissors, tweezers, gauze pads, adhesive tape, thermometer, band-aids, assorted sizes, antibacterial ointment, insect sting preparation, and anesthetic cleaning solution, triangular bandages, rubber gloves, protective eyewear, a protective face mask, and cold pack. The first aid kit together with the first aid instruction manual, which must be always kept with the kit, should be stored so that it is not accessible to children, but is easily accessible to employees. All first aid kits should be periodically inspected for contents. Depleted and out of date materials should be replaced. Special attention should be exercised when utilizing first aid supplies or any medications for children who have allergies or other special medical needs. For additional information on supplies for first aid kits, contact your local office of the American Red Cross. Okay. Thoughts, comments? I think that that's kind of a lot of information. So we make it organize it slightly better. Any other thoughts?
I agree, and it was a little bit of redundancy in some parts of it, so you can just kind of clear that up. I think that will.
Any other thoughts? No other concerns or thoughts? We're moving on to item number 21. Rule 1.19.2.1A, lifeguard supervision. 1, swimming pools, lakes, etc. A person having an American Red Cross lifeguard certificate or the equivalent as recognized by the licensed agency shall be present at all swimming and water activities. Any thoughts or concerns on item number 21?
Again, that's a little vague. Any water activity like a water table or a sprinkler or, it's a little vague. That's just my thought.
Okay. Yeah. I agree, because one, it says swimming pools, lakes, etc., but then down there it just says any water activity. So, and I think we may have talked about that a little bit when we was talking about buildings and grounds, that needs to be clarified, so it's clearer which water activities require an actual lifeguard to be on hand. So that's a good point. Thank you. Any other thoughts on item number 21? All right. We're moving to item number 22, Rule 1.22.10, caregiver CPR and first aid certification. Caregiver CPR and first aid certification. 1, all caregivers in summer day camps are required to have current CPR and first aid certification, copies of which shall be kept with their personnel records. 2, in school-age programs that operate in a central location, there shall be at least one caregiver on the premises at all times. The facility is in operation and has a current certification in CPR and first aid. When groups of children are away from the central location for field trips, etc., there should be at least one caregiver with the group that holds a current certification in CPR and first aid.
I have a question about that. In one, it says all, but in all the others, it says that just one certified first aid and CPR staff member must be present. Do we want to require summer day camp to be different than the rest? Because that would make it to where all of their caregivers have to have that certification. So I think it should be just still the at least one.
Tina or Sharita, do you guys know why the difference for summer camp programs versus the school age and regular child care programs?
I do not, but my school age programs, it's in their bylaws because all mine are YMCA's. So they all have it. It's their organization. I wish everybody had to have it in childcare, but I know that's not realistic. I'm just still for more than one. But I don't know why there's a difference. I questioned that myself.
Yeah, we can research that, Jamila, because I agree. If there's no um reason or rule that they have to have something different, I think it makes sense to just make it consistent across programs.
Right.
Any other thoughts on item number 22? Okay. Well, at this point, we've made it through the entire document. Are there any other thoughts or comments from the work group before we open it up to comments from the general public and other advisory council members? Hearing none. I see Miss Ellis has her hand up. Miss Ellis, how are you doing today?
Fine, how are you?
Um,
I think I've done a very good job at going over and reviewing these regulations. I would like to see on the items of choking hazard, when you listed what first aid items should be in a first aid kit and you've listed other things. It's always good to have a list. These regulations will be probably one of the best documents for training that we can have. But we need to list choking hazards such as hot dogs, carrots, grapes. And you'd be surprised at the number of people who aren't aware of the choking hazards for children under the age of 4. I think it would be nice just to include a brief list. I'm sure they're available online, and HHS probably has a list, but that should be included. That would be very helpful.
Thank you. I agree. Like I said, the more information we can put in the regs, because like I said, this will be a training document to be very helpful for the providers and for the licensed officials. So I definitely think we need to have that
And
information.
and especially for hot dogs, because I think some providers are serving hot dogs as a meal. And I'm not even going to address the nutritional value of that, but it is a choking hazard for children under the age of 4.
Mhm. Great. Any other thoughts or concerns about the rules that we went over today? You can raise your hand or you can put your name in the chat if you want to make a comment.
This is Dolores Sewell.
Hey,
How is everybody today?
good in yourself?
Fine. I just want to commend you all. I really want to commend the group, and Chad, thank you again for recommending working with parents on what their children need rather than getting into arguments because of what the health department says. It really helps to kind of leave it up to the centers and the parents about their children. This is just wonderful to hear that recommendation.
Thank you, Ms. Sewell. Any other thoughts or comments? Not seeing any other hands or names. So if there's no other thoughts or comments, again, we want to thank you guys for joining us this afternoon for work group number 8. We have work group number 9 tomorrow. And then after we complete work group number 9, we will look at going into the second set of meetings to discuss updates from our first meeting. So I do appreciate all the feedback we've received. It's been very helpful. And I'm looking forward to seeing you guys tomorrow. And then after that, we will get back in touch soon. And we will start back on the round 2 of the meetings to, like I said, look over the information that we came up with as areas of concern in our first work groups. Thanks again. See you guys tomorrow for those who will be joining us.